Welcome to the Retzel Health Law Hotspot. Health Law Hotspot is a podcast for physicians and health professionals that covers the legal issues and trends that affect the healthcare industry.
Everyone, welcome to the Health Law Hotspot. I'm Ericka Adler, shareholder and leader of the healthcare practice at Retzel and Andrus. Today, I have Matthew Godley with me. Matthew is a cost reduction expert in the healthcare industry. He works with a team that strategizes to lower administrative expenses, especially for independent healthcare practices, things like payroll, health benefits, retirement plans, payment processing, and insurance. And he's done such a great job with this company that some of his clients, and some of them might be solos, some might be groups, have actually reduced their costs by 20 to 40% in these categories. And you've actually found them cost savings of more than $100,000 annually. So I thought this would be a great topic for some of our independent practices out there. One of the greatest challenges for an independent practice is staying independent. And some of these costs that we're talking about here are the things that make them just give up and go work for someone else or shut down. So let me just also mention that Matthew is the CEO of Spendly, which is a firm or a company that just specializes in this. And we're really excited to have him here with us. So welcome.
Hi, Ericka. It's exciting to be here, and thank you for that warm introduction to everyone.
All right, so let's jump right into it then. Tell us a little bit about some of the struggles that you're seeing practices facing, especially when they come to you, and maybe tell us a little bit about how you've been able to kind of help them overcome those struggles.
Absolutely. Well, I'm a bit of a unique situation in upbringing. My parents actually had their own dental practice, so I got to see firsthand what it's like to run a practice. And I can tell you that the priority is where it should be. It's on the patients and the clients and managing the day-to-day to ensure everyone has the best treatment and care possible. The last thing that's on most people's minds is really financial efficiency and cost reduction strategies. And the reason being is it's very time consuming and overwhelming with applications and calls, emails, the sales pressure to discover better alternatives. It's no trivial task. And the problem is most of these practices are overpaying 20 to 40% on those administrative expenses like payroll, health benefits, retirement plans, payment processing, and commercial insurance. So sometimes they just stay put because there's just not time or an effective way to do so. And having realized that, my co-founders and we decided to create a platform that really helps simplify that process of discovering better alternatives in the market. Now, whether someone's getting these services for the first time, or they're looking, as you mentioned, to kind of just increase financial efficiency, we're able to work with a variety of practices to simplify that process, help them reduce those costs, and to keep more than they're actually spending unnecessarily.
All right, so how does the process work then? So I'm a practice, and I contact you and I tell you that, oh my God, our costs are through the roof. Do you just kind of take note of what they're paying and who they're with? Or is there a process, kind of like almost like a broker for insurance, where you can kind of pitch something out there and get a bunch of different pricing? Or how exactly does it work?
So a practice can join Spendly at no cost. And we have a meeting, we learn more about the practice, and on average, practices will select 3 to 4 categories that they would like to reduce costs on to begin. And that can come from a variety of different areas, whether they're really unsatisfied with the customer service or the product, if it's payroll or payment processing, or if they've just noticed that those rates and terms have been increasing steadily over a period of time. So we start by identifying where their priority is, and then we help them upload information like an invoice or an agreement for that service category, and they're done. So there's no applications, calls, emails. We do all the heavy lifting. We have a network of providers that includes ADP, JP Morgan Chase, the Hartford, and they're actually able to review these existing rates and terms and within a window of time submit their best offer. And when that time window expires, we then prepare a cost reduction analysis, review this with the client, and let them know what offers have come in that are better than their existing rates and terms. And they can decide, they have full autonomy to either accept a new offer that we've received, or if it seems like making a change would be too heavy of a lift, then we can go and renegotiate rates with their existing provider. So either way, they get to decide how they would like to realize cost reduction and realize savings.
So, in what area do you find that they're usually overpaying? Is there like a particular one that every single time you can get the cost down? I imagine sometimes that people just come in competitive, but is
Right.
there an area where there's always overpayment?
Before joining the podcast, I just checked our Q3 statistics. We worked with a little over 40 practice locations, and the average cost reduction that might shock you for payment processing was around 51%. And the average cost reduction on payroll was around 44%. So percentage wise, we see that number really high, somewhere between 30 and 50% on average. And when it comes to insurance and health benefits, that number can float anywhere from 10 to 25%. One thing about health benefits and insurance that I always like to highlight, and some people will say, well, cheapest isn't always best, and we agree. It's important to emphasize that when we talk about cost reduction, we're also talking about cost reduction for an equal or greater amount of coverage or an equal or greater service than what someone's currently working with. So we're not just reducing cost and diluting the quality or the service or even the customer support. Quite the contrary, we actually have negotiated to have a designated representative for clients of Spendly to not have to deal with a 1-800 number. So in many cases, with those cost reduction percentages, we're actually increasing customer support, and it's for an equal or better amount of coverage.
Great. So, is there an area where, so it sounds like payroll for sure is one where people might
Yes.
be paying too much, and insurance. It's interesting because for healthcare providers, insurance products are changing a lot. You used to just need malpractice. You guys, do you get involved with malpractice or more general liability?
We can do both, the general liability and malpractice.
So within that realm, there's like the HIPAA insurance and the cybersecurity. And I've been having these conversations every day that doctors need to make sure they have that included. Sometimes I've seen malpractice carriers included, sometimes general liability included. But if your insurance is almost worth nothing if you're not covered, because those are the things we see doctors getting sued for the most right now. So, and you would think you have to pay more to get those things, but sometimes you just need to know what to ask for, right? So I think it's buying it just from your neighbor down the street who sells insurance is not always the way to go, right? All right, so I know you were going to share with us some particular case scenarios. Do you want to go ahead and do that?
Sure. We had a case study over the summer, a dental group with 8 locations. We met with the managing director, and he said, look, I really would like to focus on 3 areas: health benefits, commercial insurance, and payment processing. We were able to help discover around $127,000 in annual savings across those categories for him. And he was really excited because he's very financially oriented and is looking for ways to obviously reduce costs. He had an incentive to also increase EBITDA, because some people might just think, wow, $127,000 a year, that's a lot of savings. And on the other side, he's excited about that, but it actually probably increased the valuation of his company somewhere between 6 and 7x that $127,000.
Wow.
just top line EBITDA.
Right.
So I think we're seeing people are either really unhappy with where they're at, they're looking to reduce costs, they're also looking for that market multiple. And we've also worked with small practices too, solo practices, where we've been able to help reduce costs anywhere from 20 to 40%. And that's, can range anywhere from 15 to $20,000 on the low end that just goes directly back into a doctor's pocket and, can
Right.
then afford those health benefits or invest in some new equipment or invest in
Right.
sales and marketing to get the word out. So one thing I highlight is depending on whether it's a solo practice or a DSO or any group practice for that matter, we're seeing the same range of cost reduction. It just depends on unit economics and how large the practice is, how many employees they have. So that's one of the case studies I wanted to highlight and also share that if you're, less than 8 total locations or you're much more, we've
Right.
still been able to come in at that cost reduction
Right.
percent.
And that makes sense. And so just a couple of things to clarify, for physician practices, dentist practices, reimbursement is constantly a challenge, right? So if your reimbursement is going down, but your costs are the same or going higher, there's a disconnect there. So absolutely, I think that's one of the challenges for doctors who are trying to keep independent, not, go work for a PE or a hospital. So that little bit of savings does make a difference. I also want to explain EBITDA because I don't know that everybody listening will understand what that is, but basically that's a measurement that's often used when you're valuing your practice, particularly if you're going to sell it to private equity. They look at what the EBITDA is. And so you want to improve your EBITDA, right? Which means increasing your earnings and decreasing your costs. So if you can show an improved EBITDA, then your purchase price will be higher. And a lot of times we work with practices, particularly in the year before they want to sell, to improve their EBITDA, right? To make them more valuable, get a better purchase price. So just want to explain, because not everybody knows the terminology, but I know so many people out there, although I want everyone to stay independent who can. But if you are thinking of selling, this is not something that you just say, oh, I don't need it, right? It's still something that really could play an important role in getting all the value out of your practice. So a big, important point to make. All right, so is there anything else you want to tell us about, these thoughts that you have about how healthcare providers can reduce costs? Any other thoughts you want to share?
Yeah, I think one question we get a lot about Spendly is people associate or conceptualize Spindly as a broker. And we see it a lot of times when people say, well, I work with an insurance broker, I work with a healthcare broker. There are a lot of great brokers out there. One thing I wanted to emphasize is around 96% of practices that join Spendly are able to reduce costs even though they work with a broker. And something to bring to people's awareness. The broker model is a bit unique, and not all brokers work this way. But I'm just going to share a story, and it might be helpful for some people. We had a practice that worked with a broker for around 30 years. And they said, I know my broker, I've known them for a long time, and I feel like they're giving me the best offer available in the market. And that very well could be the case. So we asked in kind of a discovery call, how long have you been with that specific carrier with the broker? And they said, for over 30 years. And this was an individual carrier. And so what had happened was we were able to discover actually almost twice the coverage amount for a reduced premium of about 30%. And it's pretty common that we see, again, if you have a great relationship with your broker, maybe it's a relative or it's a childhood friend. Relationships are important. I'm not saying that isn't important. I just want to bring awareness that sometimes the broker model doesn't actually search for the best offers in the market. And the reason being is because brokers, a lot of times with each individual carrier, have minimum requirements that they have to perform. And that could be a total number of insurance premium brought into the carrier. That could be a total number of insurance binds or policies that are written. And what happens is carrier or brokers are rewarded by carriers by allowing them to earn commission on the actual policy that's written. They are also able to build up their book of business and the value for that book of business. And they're also incentivized by, at a certain threshold, realizing a percentage of profit share. So the broker, a lot of times, isn't necessarily incentivized to search for the best offer in the market. They want to continue to gain access to that profit share. So in the case of this practice that was with one carrier for 30 years, that's what was happening. We see that happen a lot. And if you're asking, well, how is Spindly different? We're different because we're not directly connected to any broker or any insurance carrier on the benefits or on the property casualty side. We're not building up a book of business. We're not engaging in any profit share. We're incentivized to find the best offers on these categories based on performance, because how we make money is real simple. We make money from a percentage of actual realized savings, not estimated savings, but realized savings that are shown on the balance sheet. And I think that's always important for people who are excited to learn more about Spindly. Normally they have a question about Spindly and how we operate. So I wanted to expand on that. And it's also privacy protected. So we're not selling any data. We're not sharing any personal or corporate data. If you've ever entered some information online and you just get solicited by emails and phone calls, a lot of companies make money that way. We don't. It's based on performance. So for those who are considering cost reduction and may have had those questions in the back of their mind, there's some of the most popular questions we come across. Wanted to share that before wrapping up the podcast.
Yeah. No, that sounds great, and I'm glad you brought that up. I can think of off the top of my head a bunch of clients that really should be talking to you to figure out if what they have is really the best. And we will share your information when we post this podcast, so you'll be able to reach out to Matthew Godley directly. If you have questions, you can also reach out to me, although I'm not sure if I'll be able to answer any of those questions, but I can definitely get you over to Matthew. Well, thanks for joining us. I really appreciate it. And I hope you'll come back another time and keep us updated on what you're doing. This has been the Health Law Hotspot. You can see the rest of our podcast at ralaw.com, and we'll see you next time. Thanks.
The Retzel Health Law Hotspot is made available by the firm and its attorneys for educational purposes and to provide general information, not to provide specific legal advice. Use of the Retzel Health Law Hotspot does not create an attorney-client relationship between you and the firm or any of its attorneys. The Retzel Health Law Hotspot should not be used as a substitute for competent legal advice, and you should contact an attorney in your state about any legal needs or questions you may have.